Hearing loss meets its match. The stem cell revolution. This could be the moment hearing loss meets its match. For the first time in history, scientists have successfully regrown damaged auditory nerves by injecting stem cells directly into the inner ear. In clinical trials, patients began regaining natural hearing within weeks. What once seemed impossible, repairing the delicate structures of the ear, has now become reality. This breakthrough could transform life for over 430 million people worldwide living with hearing loss, many of whom thought silence was permanent. For decades, hearing loss has been treated with devices rather than cures. Hearing aids amplify sound, while cochlear implants bypass damaged cells to stimulate the auditory nerve directly. These technologies have improved lives, but they do not restore natural hearing. They are workarounds, not repairs. The dream of regenerating the microscopic systems that allow us to hear tiny hair cells, neural connections, and the intricate pathways of the inner ear remained elusive. Until now, stem cells changed the equation. These remarkable cells have the ability to transform into specialized types, repairing damaged tissue and restoring function. By injecting stem cells into the inner ear, scientists triggered regeneration where medicine had previously failed. The stem cells didn't just help, they rebuilt. They reconstructed the fragile hair cells that detect sound vibrations, reconnected the neural pathways that carry signals to the brain, and restored the microscopic systems that let us hear laughter, music, and language. The result was not replacement, but renewal, natural hearing returning after years of silence. The implications are staggering. Hearing loss is one of the most common disabilities worldwide, affecting people of all ages. For children, it can hinder language development and education. For adults, it can isolate, erode confidence, and limit opportunities. For the elderly, it often accelerates cognitive decline as the brain struggles without auditory input. Restoring natural hearing could change all of this. It could give children the chance to learn without barriers, adults the ability to thrive socially and professionally, and seniors the gift of connection in their later years. The emotional impact is equally profound. Imagine the moment when a patient hears their child's voice again, or listens to music after years of silence. Imagine the joy of hearing laughter, the comfort of spoken words, the beauty of everyday sounds once thought lost forever. These are not luxuries, they are essential parts of human experience. The breakthrough in stem cell therapy offers not just medical progress but emotional restoration, reconnecting people to the world in ways that technology alone could never achieve. Of course, challenges remain. Clinical trials are still in early stages, and scientists must ensure the safety and long-term effectiveness of the treatment. Questions of accessibility loom large. Will this therapy be available to millions, or only to a privileged few? Will healthcare systems adapt to make regenerative hearing treatment affordable? These are critical issues that must be addressed if the breakthrough is to fulfill its promise, but the path forward is clearer than ever. What was once science fiction is now science fact. The discovery also reshapes our understanding of healing. For centuries, medicine has focused on managing symptoms, compensating for loss, or replacing damaged parts. Stem cell therapy represents a new paradigm, repair from within. It is not about louder devices or external fixes. It is about cellular healing, about harnessing the body's own potential to regenerate. The future of medicine may not be mechanical, it may be biological. And in the case of hearing loss, that future is already arriving. Philosophically, the breakthrough invites reflection on the nature of silence and sound. Hearing is more than a sense, it is a bridge to connection, culture, and identity. To lose it is to lose part of oneself. To regain it is to reclaim life. The stem cell revolution reminds us that healing is not just about survival, but about restoration, about giving back the fullness of experience that makes life meaningful. In the end, the story of regrown auditory nerves is not just about science. It is about hope. It is about the possibility that silence can be broken, that loss can be reversed, that the future of healing is not louder, but cellular. Tiny hair cells, neural connections, microscopic systems all rebuilt, not replaced. The breakthrough is more than medicine. It is a promise that the smallest cells can carry the biggest solutions, and that hearing loss may finally meet its match.